happy to have Claire to share her story on the Arthritis Life podcast today. Welcome, Claire.
Hi, I'm so excited to be here.
Oh, I'm happy to have you. And can you just give the audience like a quick intro to yourself? Like, where do you live and what is your relationship to arthritis or chronic illness?
So, I am a California girl, born and raised. I've lived in California my entire life, and I am currently living in a sleepy little beach town just a few hours north of Los Angeles. It's where I grew up, and I absolutely love it here. I moved home unexpectedly during the pandemic when I was experiencing very mysterious health issues, and spoiler alert, I don't have arthritis. However, the arthritis community is really near and dear to my heart because for many, many months, I was being prepared for an inflammatory arthritis diagnosis. And so the arthritis community was the first place where I, found other people to talk to who I had shared experiences with, and where I first got resources that helped me. So like, even though now I am living with myofascial pain syndrome and something called autistic burnout, but I think that the arthritis community is probably going to be near and dear to my heart for the rest of my life, simply because that was the first place where I found community.
Wow, that's so powerful. And it's really true that, there's an overlap, a significant overlap between these specific conditions that have arthritis either in the name or as a symptom of the overall, autoimmune or inflammatory condition. And then there's just general pain
Mhm.
conditions, and we are really united. A lot of the things that are difficult about living with arthritis are things that are difficult about living with pain in general. I'm laughing because I'm like, this is really obvious, but it's also like, um, it's like this double-edged sword when we have disease specific communities. It is so powerful, but also we can miss out on the possibility that, like, if you're like, I only belong in the arthritis community, you might miss out that actually I belong not only in the arthritis community, I belong in the overall chronic illness community, or I also belong in the chronic pain community, so sorry, that's just a little,
Yeah, exactly. And I mean, for me, it's like, this is, like I said, this is a space that is very near and dear to my heart. And I think it always will be, especially because I'm studying to be a physical therapist. And so I know for a fact that I will someday have patients who live with rheumatic disease. And I really, really hope that my experiences and the time I've spent in this space will help me to be a better therapist to them.
I'm 100% sure it will. And you might be surprised how many different conditions it helps with, even like I used to work with, children with developmental differences and talking to their families just about some of the burnout they experience and stress from just navigating the healthcare system. There's a lot of similarities with navigating the healthcare system as like somebody with a developmental disability versus somebody with a chronic illness. There's just some of those same barriers and that feeling of a power struggle, like these people who have the power to help me, I'm not able to get to them through like structural barriers, so, but yeah, like I don't want to skip over your diagnosis story. So as you alluded to or mentioned, you had a lot of mysterious health
Mhm.
issues going on. Can you tell a little bit more details? What were they, and what kinds of providers did you seek help from?
So I have a very long and convoluted diagnosis story. And as I tell this story, one thing that I really want to emphasize is that when all this was going on, I was like 20 and 21 years old. I was like learning how to live as an independent adult. I like didn't really have even like a primary care provider or anything like that. My entire experience of receiving medical care had mostly been like, oh, my parents will like take me to the doctor and I'll go into the office by myself and the doctor will tell me what to do, and that'll fix the problem. I'd never really had any serious health issues before that doctors had not been able to fix. So, but what really started me down this path with chronic illness was in the summer of 2019. I went on a horse packing trip in Wyoming for 3 weeks. So I was out in the mountains. I was in the saddle for up to 8 hours a day. I was lifting 75-pound packs on and off pack horses. I was breaking camp and setting up camp and sleeping on the ground. And while I was out there, I also got a head cold, which, as you can imagine, it's miserable to have a cold when you're at home, but when you're out in the middle of the wilderness, like hundreds of miles away from anywhere else, and you're like expected to be on a horse all day long, it's a pretty miserable experience. So I'd worked with horses for 8 years prior to this. I had raised service dogs. I was a backpacker and a hiker. So I was used to hard work. I was used to what it was like to be out in the back country. I was used to pushing through when things got tough. So I kind of expected that, the aches and pains I was experiencing and the fatigue that I was experiencing would go away once I got home. It never did. I,
Mm.
I went back to school and I was a full-time student and I was so fatigued. I was dragging myself to class every day. Was so tired. I felt like I couldn't get out of bed. I was having pain in my right shoulder and down my right arm, and I just didn't know what was going on. And when I went home for Christmas break, my parents were obviously very concerned and pushed me to go to a doctor. So I'd seen like one primary care physician before. So I went to go see her again. And she was also obviously very concerned that I was presenting with, this really severe fatigue and inexplicable chronic pain and brain fog and all of these symptoms that are not typical of someone in their early 20s who,
Mhm.
was at one point an athlete. Um,
Right. And so you didn't, so just to be clear, before the backpacking experiences in 2019, you hadn't had any history of any health, like you mentioned earlier, you hadn't had like many health issues, right? Like,
yeah, I mean,
or
I'd had normal childhood illnesses.
yes, yeah.
I'd had some issues with my mental health, nothing really with my physical
Hmm.
health. Like the most serious thing that had happened in the years prior was that I'd been diagnosed with asthma, that by that point was well
Mm-hmm.
controlled.
Right.
Everything else
Yeah.
up until this point, there'd never been any really serious thing that had made people think, there might be something more going on with her. But when I
Mm-hmm.
first went to this primary care doctor, she was obviously extremely concerned and sent me for a bunch of blood work because she wanted to know what was going on. All the blood work came back normal. So she switched me to a different antidepressant and told me to exercise more. Now,
Mm-hmm.
during this time, I went home for spring break and never returned to school because a worldwide pandemic broke out. So during this time, switching to a different antidepressant helped a little bit. It did help some with the fatigue, but it wasn't a cure all. I was still experiencing intense chronic pain, and I was starting to experience it in other parts of my body. And I knew that I needed to get more help, but I couldn't. Like I suspected that I probably needed to see an orthopedist, but the only thing they would offer me was a video visit. And I was like, well, this is completely pointless. I need a doctor to physically examine me.
Yeah, I can't imagine having those kind of symptoms during the pandemic. I mean, my heart goes out to to you because yeah, that's really, really rough to know that, you can't even come in to get a physical exam. I'm so sorry. Oh.
Yeah, and I mean, it was a wild experience. The first provider I saw who actually looked at me was my current physical therapist, who my dad had been a patient of hers, and he take my appointment with her and see if she can help you. She was the first provider I saw in person, and she was like, yeah, you need to go to an orthopedist. There's something going on with your shoulder. At this point, we didn't really suspect anything systemic because the fatigue had gotten somewhat better. And so we were really just focused on my pain. So she was able to, here's an interesting thing that now looking back was a really obvious clue that I had myofascial pain syndrome. This PT that I went to go see is an expert in myofascial work. She did some myofascial work on me. And immediately afterwards, I was able to stand up straight for the first time in several months, and my pain was significantly decreased. However, myofascial pain syndrome wasn't even on the horizon as an option at that point. It was like, go to an orthopedist, you probably have like biceps tendonitis or something like that, and they'll be able to help you with a little bit of PT. So I finally was able to go to an orthopedist, and it was an incredibly traumatic experience. This guy was incredibly rude to me. There was a med student in the room who he was also incredibly rude to. I left his office in more pain than I came in with because he was so rough when he examined me.
Oh, I'm so sorry. That is horrible. I mean, I don't, yeah,
Yeah,
to feel worse than when you walked in the room, that's really significant.
yeah, and it was a very scary experience for me because I'd been to doctors that were like kind of like meh, they were okay. They didn't like
Hmm.
really take me seriously, but like I'd never had a doctor actually hurt me before. So that was a
Yeah.
terrifying experience. And I ended up not going back to that orthopedist. He was like, okay, I'm going to send you for an MRI and then come back. I ended up taking my imaging and going to a different orthopedist who was better. And he looked at the MRI and he said, there's nothing really wrong with you. And after examining me, he said, oh, you probably have biceps tendonitis like your PT thinks. So he gave me a shot of cortisone in my shoulder and sent me to PT and assured me I would be as good as new in 6 weeks.
Hmm.
I ended up seeing two different physical therapists every week for 9 months as
Wow.
things got worse and worse and worse and worse. It was no longer just my shoulder and right arm. I started having neck pain and back pain and hip pain and foot pain and ankle pain. And it was an incredibly scary time because no matter what I did, things kept getting worse. And I kept going back to my orthopedist and being like, this isn't working. What's
Hmm.
going on? And he kept saying, interesting. Well, we'll send you back to PT because that's the only thing that kind of seems to help. So we'll just keep sending you to PT. And then I'm also going to send you to a bunch of other specialists. So, like, I've lost count of the number of x-rays I've had now.
Hmm.
I went to see an ankle specialist who was great. He was really, really nice to me. I also went to see an electrodiagnostician, which I didn't even know that that kind of doctor existed. And he did a bunch of tests on me to check if my nerves were functioning correctly. I ended up in an orthopedic urgent care after
Oh.
yeah, because I sat down on the floor one day and when I stood up, my legs started going numb. They had no idea what was going on with me, but they said, okay, we're going to prescribe you some Celebrex and take it for a month and see if it helps.
Hmm.
Now, here's the really interesting thing. When I started taking Celebrex, most of my symptoms went away. I felt the best that I'd felt in years at
Whoa.
this point. Yeah, it was wild. So the next
So
time,
so it is okay, I'm just looking up Celebrex because I always forget. So is it an anti-inflammatory?
so it's a prescription strength anti-inflammatory
Okay.
that is specifically created to treat pain and inflammation from conditions like rheumatoid arthritis
That's what I
or
thought. Okay,
ankylosing
okay.
spondylitis or psoriatic arthritis. At the
Okay.
time, I didn't know this, but I was
Okay.
going to learn this very, very quickly because
Yeah.
I had been going to different specialists and shunted to this from this office to this office, and everybody was like,
Mhm.
we don't know what's wrong with you. It's interesting that you're in pain, though.
I mean, and it's so hard because pain, I really tend to think of pain science is still in its infancy. Like,
Mhm.
unfortunately, and pain is not really a big part of most doctors' training. Like, there are pain medicine clinics, but your average doctor, and I don't want to be one of those people who's like, doctors don't know, because I'm like the biggest, proponent of like going to the doctor and trying, seeking expert help from actually legitimate like licensed professionals. But it's just true that a lot of providers aren't really equipped to diagnose pain syndromes, especially when they don't present in like a typical way. So
Yep,
yeah, I'm
exactly.
sorry you're
And again,
experiencing.
I'm like you. I am the biggest proponent of going to the
Yeah,
doctor
yeah.
and having a good relationship with your provider and getting evidence-based medical care. But at the same time, I also have to tell people you have to be realistic about what these doctors know.
Yes,
Realize
yes.
they might not always have the answers. And this is one thing that I really wish is that my orthopedist had admitted that he didn't know what was going on with me earlier than
Mm.
he did. Because after I hurt my back, again, I went to go see him. And at this point, he had like started losing patience with me
Mm.
because I was too complicated and he couldn't figure out what
Yeah.
was going on with me. And at one appointment, I had dared to suggest that I might have something called thoracic outlet syndrome
Oh yeah.
because the PT that he sent me to suggested that I bring it up with him. He
Mm-hmm.
got really mad at me that I dared suggest any kind of diagnosis. And at that point, our relationship really
uh,
started falling apart. So at this follow-up appointment after I hurt my back, he kind of looked at me and looked at my symptoms and examined me, and then very casually said, I don't want to freak you out, but I think you have multiple sclerosis and you need to go to a neurologist. As you can imagine, that really freaked me out.
yeah, yeah.
And so I was like, okay, let's make an appointment with the neurologist. Of course, it takes a long time to get an appointment with a neurologist. So I had to wait 4 or 5 months. And during that time, I figured, okay, if I might have MS, I should learn as much as I can about this condition. Because if it's
Mhm.
something I'm going to have to live with, I might as well know what I'm dealing with. And so I started researching MS. And the more I looked at the symptoms and the progression of the disease, I thought, this doesn't fit. I don't know
Mhm.
what I have, but I don't think it's MS. And the thing that really clinched it for me was I started looking at the different medications that are used to treat MS, and I specifically looked to see if Celebrex is used in the treatment of MS. And in fact, I came across research papers that said Celebrex is not effective in treating MS. And that was the light bulb moment in my brain when I thought,
Mm.
okay, this can't be MS because this prescription anti-inflammatory is taking away most of my symptoms. Something's not adding up here.
That's
And
really that's
yeah,
really bright of you, because a lot of people who get preliminary diagnoses in rheumatology, they'll say, it's really weird. My doctor says they want me to try this medicine, and if it works, that'll give them a clue as to what my diagnosis is. And I'm like, no, that's really, really common, actually. Like, especially like prednisone. If prednisone works, that's like a good sign that it is an inflammatory condition versus something else. So yeah, so you were already doing like the doctor's job to some
yeah,
degree,
yeah,
and
because no other doctors were doing their job.
yeah,
And I'm the person, I'm like, no, don't Google stuff. You're just going
yeah,
to
oh,
figure out. Like, I was the person who was like, no, I have health anxiety. I'm not Googling my symptoms. But it got to the point where I was like, well, someone has to do something.
exactly.
And the only thing I have is Google. So I
Mhm,
taught myself to read research papers. I was a literature major in college. I was not a science person at this point. So I taught
mhm.
myself to read research papers because it was the only way I was figuring out
Wow.
information. And finally, one of my PTs suggested that I needed to look into autoimmune conditions after all my nerve tests came back normal. So I went to Google and I typed in joint pain, autoimmune disorder. And the first thing that came up was rheumatoid arthritis. I
Mhm.
started reading through all of the symptoms, and it was like something kept clicking in my brain. And I was like, chronic fatigue. I have that. Chronic
Yeah.
joint pain. I have that. Swelling. I have that sometimes. And I was just reading through all these symptoms and I'm like, this all sounds terribly familiar. So
Right.
I went and I looked to see what kind of specialist treats rheumatoid arthritis. I saw, okay, I don't think I need a neurologist. I think I need a rheumatologist.
Mhm.
So I took a risk. At this point, I had been dismissed by so many doctors and I was so done with the medical system. But I said,
Mhm.
okay, I'm going to try one last time. I'm going to make an appointment with a new primary care physician because I hadn't had a primary care physician in 2.5 years at this point because of the pandemic,
Right.
because I moved home unexpectedly. So I made an appointment with this new primary care physician, and I was so nervous going into her office because I knew I was going to have to say, listen, I've been doing some research and this is what I think I need. And I was expecting her to get mad at me like that orthopedist had. But instead, she took me seriously. She looked at my symptoms and she examined me. And then she looked at me. She was wearing a mask and glasses, and she looked at me over her mask and over her glasses with the most disgusted expression in her eyes and said, why did this orthopedist send you to a neurologist? You obviously need a rheumatologist.
Yeah.
Yeah. And
Oh,
so lo and behold, the clinic where my new primary provider they just hired a new rheumatologist.
oh,
She
good
said,
timing.
and she said, "Oh, our new rheumatologist is lovely. I'm going to do some blood work, but I'm also just going to send you a referral to the rheumatologist so you can get in to see her." And so by September of 2021, I was in the rheumatologist's office. And again, I was so nervous to go see her because I had no idea what a rheumatologist did. I'd never heard of a rheumatologist before. So I had no idea what
Most people
it was gonna be like.
haven't.
And
Yeah.
I mean, like, I had no idea. And again, she was so great. She took me seriously. She listened to me and she said, no, you're on the right track. I'm going to send you for blood work and some more imaging, but you were right to come in and your concerns are valid. Like, it really
Mm.
does look like maybe you have an autoimmune disorder. And so, of course, she did blood work and we did some MRIs and it all came back normal. And now, if you've spent any time in the world of rheumatology and you're listening to this, you will know that that doesn't really mean anything in the world of rheumatology. You can have
Yeah.
normal blood work and normal imaging and still have something going on.
Mhm.
So, but I remember my rheumatologist sat me down to explain what was going on. She said, you're so young that you probably haven't been sick enough for something to show up yet. And we're just going
Mhm.
to have to wait. And she told me a couple stories about other patients she'd had just like me who had mysterious symptoms and they'd finally gotten a diagnosis. And then she said something that I'm so glad she said this because I'm not sure what I would have done if she hadn't said it, but she said, I haven't forgotten about you. We just need to wait a little bit longer.
Oh my gosh. That's like giving me chills. I'm sorry
Yeah.
because like I had I was 20 when I first started having symptoms or 19, 20, and I got diagnosed when I was 21, but I felt like so forgotten and delegitimized and that those words, if I had heard those, would have changed my mental health so drastically. Like I would have felt so much better if someone had just said, we need to believe you that there's something going on here. We just don't know what it is. Like it's okay to say you don't know, but just knowing that they at least care about you is such I mean, how did you feel when you heard that? Sorry.
I just about started crying from
Yeah.
relief in the office because I felt so ignored and so delegitimized, even from the specialists who had been really kind to me. They were just kind of like, yeah, this is interesting, but we don't know what's going on. See you later. Whereas my rheumatologist was like, listen, I suspect that this might be early onset inflammatory arthritis. Maybe it's psoriatic arthritis. Maybe it's ankylosing spondylitis. Maybe it's rheumatoid arthritis. Maybe it's, Sjogren's or lupus. We can't tell right now, but there's something going on. we're going to wait and see. And just having her promise that she hadn't forgotten about me was so gratifying. And that made me feel so much better because I had felt like doctors were just kind of pushing me aside because they didn't know. And so basically, what she told me is, listen, you're doing everything right now. I'm going to give you a prescription for Celebrex. Take it twice a day. Keep exercising. Keep going to PT, and just wait. We're going to figure this out. And so once again, I figured, okay, if I have some kind of inflammatory arthritis, I should I should learn about this. I should figure out as much as I possibly can now. So I started following people online who had inflammatory arthritis conditions. I started reading their stories. I started, looking at like the Arthritis Foundation and Creaky Joints and all of those amazing resources that are out there. And I learned so much. And I genuinely did start to get better. I was still very, very sick, but I started improving. Suddenly I had tools to help me every single day. But the thing was, even though I was getting better, I didn't have things under control. And I really tried to hold on because my rheumatologist, she specifically said she wasn't forgetting about me because she was about to go on maternity leave. And so she
Oh,
didn't want to
yeah.
worry me. Oh, she didn't want me to worry while she was gone. She was
Hmm.
just going to forget about me. And so she said, yeah, I'm going to make an appointment for you now, so that you can see me in March. So you're not worried that I'm going to forget about you. And I really tried to hold on until that appointment in March. But by about November of 2021, I'd started to enter one of the worst flares I'd ever been in. And it was a really difficult time. Most of my flares had only lasted a week or two. This one lasted months and months and months. And by the end of January of this year, I finally had to throw in the towel and say, I need more support. I can't make it until, you know, early April when my next appointment is. And so I made an appointment with the rheumatologist who was covering for my primary rheumatologist, and she saw me in February, and she looked at me and she looked at all of my history. She was very interested by my case because I was so young and nobody could figure out what was going on. And she examined me and she looked at me and she said, this is really interesting. You have a lot of the symptoms of inflammatory arthritis, but you don't present typically. When I palpate your body, you're actually presenting with myofascial pain. I think you have myofascial pain syndrome. And
Wow.
I, so here's a note that I forgot to add. By this point, I had switched careers from I was going to be
Right.
an English teacher, and I switched careers to be a physical therapist so I could specialize in myofascial work. And so when
Worlds
so
colliding.
so I had known myofascial pain syndrome existed, but I was like, no, it can't be that obvious.
Yeah.
I'm totally biased towards that diagnosis. It can't be that obvious. So I knew about it, but I kind of just wrote it off because I was like, yeah, yeah, yeah. No, there's no way it could be that simple. And so, the rheumatologist was like, you probably never heard about this. And I said, actually, no, I know a lot about myofascial pain. I'm planning to be a PT who specializes in myofascial work. And so I asked my PT, who was my PT and had also become my mentor, and she said, yeah, I would 100% agree with that diagnosis. You are a textbook case of myofascial pain syndrome. And
And
so
wait, so sorry, can we pause for 1 second for people who don't know what fascia or myofascia is? How do you describe it?
So the fascia is connective tissue in your body. It kind of looks like saran wrap around the muscle. And for a long time, we thought it was just passive connective tissue that held things together. It's
Right.
actually a very active and dynamic system in our body. It helps keep our muscles sliding and gliding properly.
Mhm.
However, the thing about the fascia is that I like to think of it, so you've probably heard about the gut being referred to as the second brain. I
Hmm.
like to think of the fascia as the body's third brain, and it's a
Mm.
very emotional brain, and it's a kind of high maintenance sometimes.
Hmm.
And the fascia can get hyper irritated after all different kinds of trauma, viral illness, physical injury, emotional trauma. Often people end up with myofascial pain after like car accidents or something
I
like
was
that.
going to say I did in 2016, 17. I had a car accident, and yeah, I really had some myofascial. And I actually did also have diagnosed thoracic outlet syndrome too, by the way. So, but yeah, that's really, yeah, it is something you can literally, like, not to get too graphic, but like on a cadaver, or on an actual human tissue, you can see the fascia. Like it's not like microscopic, where you would see it with the naked eye.
Yeah, no, and it like, again, this is kind of gross, but, like, when you're in PT school and you dissect a
Yeah.
cadaver, you literally have to peel the fascia away from the muscle. It is,
Yeah.
like, very much an active part of your body, but anyway, when you have something like myofascial pain syndrome, you develop something called trigger points, and these are spots of hyper irritation in the muscle. Basically, the fascia gets kind of bunched up into these hard knots. My PT likes to refer to it as a snag in the sweater of your fascia. And it's kind of like this tangled up ball, and it's very, very hard and tender, and it creates referred pain. And this is really important in my story because I have a trigger point that exactly follows at the path that nerve pain would take if I had cubital tunnel syndrome, which is basically where your ulnar nerve, which is a nerve in your elbow, if it was to become entrapped, myofascial pain follows the exact same path down my arm. So this is why
Mm.
for months and months and months, people thought I had nerve pain because I had pain that was originating in a spot and then traveling down my body. And this
That's
is,
so fascinating.
yeah, it's wild. And it's really interesting because myofascial pain mimics a whole bunch of different disorders. It
Mm.
mimics early onset rheumatoid arthritis. It mimics multiple sclerosis. It mimics lupus. It is like this
Mhm.
great imitator.
Is
So
is myofascial pain worse after inactivity or better after, out of curiosity?
it is mostly worse after inactivity.
And 'cause that is very similar to
Yeah.
rheumatoid arthritis. I
So
was gonna
that's
say,
the
because
other.
that's sometimes a differentiating factor, because people with rheumatoid tend to really present with that pattern of morning stiffness, getting better with activity. But if myofascial pain is also
Yeah,
worse
I
after,
mean, and
oh,
yeah, and sometimes it will flare up if you push yourself too hard with physical activity, but, like,
yeah,
again, most
same with
often
RA
it is
though.
worst at night and in the early
Yeah.
morning. Like, I wake up, with joint stiffness and pain, and that's why people thought I had early onset, like, RA or something, because I had that
Yeah.
stereotypical early morning stiffness.
And fatigue, like, those are,
And
like, the
fatigue,
2
and, like,
symptoms, yeah.
I even had, like, swelling, and so, like, I had a joint
Mm.
aspiration and stuff like that, and
Wow.
so and it all came back normal, but here's the thing about myofascial pain, it can it can mimic other kinds of pain. So, like, it can mimic nerve pain because it causes numbness and tingling. It can also
Mm.
mimic joint pain. So I have something that I like to call pseudo joint pain, which is maybe not the
Mhm.
best word because that kind of implies that it's fake pain. But what I'm trying to imply with it is that it's pain around my joints, but it feels like it's coming from my joints. It's actually
Mhm.
because the fascia is irritated and it is binding down to the muscle and putting tension on the joints, but it feels like my joints should be swollen and hot and inflamed and tender to the touch, but they
But
aren't.
they aren't, because I was gonna say, with rheumatoid, you sometimes, if it's really bad, like, if you have pale skin, it will literally appear
Mm.
red, like, or pink, and the doctors, that's why the physical exam and the visual exam can be important in that. So that's, yeah, they're like, you have this almost like choose your own adventure, like decision making tree of like, if this, then this, like if you have these things, it could be rheumatoid, but if it doesn't have redness or, isn't worse with like palpation directly in that area. Yeah, I mean, I hope people listening maybe will be having some light bulb moments go off, because maybe I feel like I've been encountering more people on social media lately, and maybe just be that I've got more, people in my orbit or something, but more people who are in that pre-diagnosis or that gray area of not quite diagnosed yet, and it's such a difficult thing. So sorry, I don't mean to.
Yeah.
You were
It is a really
explaining.
difficult space to be in though, because
Yeah,
people are like, "What's wrong with you?" And you're like, how long do you have?
yeah,
How long?"
literally.
I mean, like, and I literally just at one point I just started telling people, I'm like, I have rheumatoid arthritis, or like I
Mhm.
have early onset inflammatory arthritis, because I was like, this isn't technically correct, but people at least understand when I'm telling
Mhm.
them this stuff. Whereas
Mhm.
before it'd be like, so your body hurts? Okay,
Yeah.
everybody's body hurts at some point. But anyway, it
Mhm.
was a very, like, weird path to diagnosis, because it was like, "We don't know, we don't know, we don't know. Oh, we think we know. Oh, wait, never mind. Now we're veering down this other rabbit hole." So sure enough, I had that first rheumatologist say that she thought it was myofascial pain syndrome. I had my PT say that she agreed with the diagnosis. Then my rheumatologist came back from maternity leave. I updated her on everything, and she said, "Yeah, I would absolutely agree with that." And now I thought this was going to be the end of the story. I thought this was going to be the end of my diagnosis story. I figured, okay, this is the end. Then, right around the time that I got this diagnosis, I started working with a therapist. And after a few months of working with her, we realized that I needed to go in for an autism evaluation.
Mm.
And that was when I learned about something called autistic burnout. And I started reading, and basically, autistic burnout is not like typical burnout. Autistic burnout is a result of needing to mask autistic traits and constantly having to put up with uncomfortable sensory experiences. And it's an extremely stressful experience for the mind and body. And essentially, at some point, you just hit a wall. Like, you just hit a brick wall, and you can no longer function at the level that you were functioning. And it comes along with a myriad of mysterious symptoms: unexplained chronic pain, fatigue, brain fog, anxiety, all of these different symptoms. And it basically, it mimics a whole bunch of chronic illnesses. So a lot of people who are not undiagnosed as autistic will often go through all of these extensive medical tests and never get any answers, because doctors don't know to look for autistic burnout. They don't even think about it. And a lot of the times, even if you are diagnosed as autistic, people don't know that autistic burnout exists. So when
Mhm.
I went in for a formal autism evaluation, I asked the specialist who was evaluating me about it. And 2 weeks ago, when I got my official autism diagnosis, she confirmed my suspicions that I was in pretty severe autistic burnout. And that was playing up and basically exacerbating all of the symptoms of my chronic illness.
Wow. I mean, first of all, thank you for being so open talking about this when it's been so recent, because 2 weeks ago is a really not a long of time to
Yeah.
process what has been going on. But is it helpful to have that explanation to kind of, because it does feel like that final puzzle, not final. I never want to say final puzzle piece, but a puzzle piece to put together.
It does, and it's
Yeah.
extremely helpful, especially because the psychologist sat down. Well, it was over Zoom, so she didn't really sit down with me.
Yeah.
But she was like she didn't say these exact words, but she was very clear that she was like, "You need to learn to manage your burnout, or your
Mhm.
chronic illness will not get better. If you
Yeah.
can't, you
Mhm.
have to learn to unmask, you have to learn to manage these sensory experiences, because if you don't, you're not gonna be able to make progress with your other health conditions."
Hmm. And can you describe for the people who, because I am pretty familiar with, the sensory issues and the masking issues that can go along with, being autistic, not from personal experience, but from my previous work. But can you describe a little bit like what does masking mean with respect to autism? And also what are some of, in your experience, some of the aversive sensory things that you've had to cope with,
So masking refers to basically kind of playing a character, basically putting on different traits to hide your autistic traits. So, like, for example, I have a relatively flat affect. So, one thing that I will do is when I am talking to people, I will aggressively raise my eyebrows in order to signal that I am paying attention to people because I generally like my facial expressions generally don't change that much. So, like, I learned, okay, neurotypical people raise their eyebrows in order to signal that they're paying attention to people. But also, other things that people do is like they will change their voice so that their voice sounds quote unquote more typical, or they will suppress certain behaviors called stims, which are basically like self regulating behaviors that kind of give autistic people the sensory input that they need to kind of calm their nervous system. And that puts, not being able to do those things puts a lot of stress on the body. Like, so imagine going out in public and thinking about every single facial expression you make and every single body movement and constantly having to observe how other people are behaving. Like, that's what it's like going out in the world when you're autistic, because even though you learn social norms, they don't come naturally to you. So you have to constantly be thinking about things, and you have to basically not act as yourself. And it's very, very exhausting. Then, on top of that, you're living in a world that is not built for you. So, stuff like fluorescent lights are incredibly draining to most autistic people because they are just so bright. The sound of traffic is overwhelming. A lot of the time, it's described as the lights being too bright and sounds being too loud and smells being too strong, which is true. But actually, in my experience, the most exhausting part is not necessarily the intensity, but the fact that my brain does not process all of the sensory input correctly. So, for example, if I'm sitting in a lecture class, I know I'm supposed to be paying attention to the professor giving the lecture. However, my brain is also trying to give equal attention to the people having a conversation 8 rows behind me, and the person sitting next to me typing on their laptop, and the person a row behind me, fiddling with their papers or whatever. And that's the difficult thing. It's not so much the intensity, but the fact that my brain is fighting to give equal attention to all of these things all the time. And trying to filter
Mhm.
that out is a lot of work.
I'm exhausted thinking about that. 100%. You described it really beautifully, and I think one of the things I remember reading a long time ago is that the process of like pruning, like sensory pruning of the nerves, is not done into the same degree. In the theory neurologically is that the pruning process of like um getting rid of quote unquote like unnecessary neural connections is not done to the same degree. So you potentially, people who are autistic have more connections
Mhm.
neurologically in their brain, which means like exactly as you described, that there's a lot of inputs happening at once, and they're very difficult to filter. And I think another thing, just throwing it out there for anyone listening, but is that a lot of times when people think about sensory differences, they think about being hypersensitive. That means like things seeming too loud, too hot, too close. But you can also be hyposensitive, and that can cause functional challenges too. You could require more input to get to enact a behavioral response. Like you need people to say your name louder, or you need more like physical input to understand where your body is in space, maybe when it comes to proprioception, which is like your awareness of, where your body is in space. So it's very much like multifaceted, because you have these social pressures from externally, right, of an entire world that's designed for neurotypical people, right, who are I consider myself one of those like excessively social people, right?
Mm,
I'm like in your face and I want to talk. I love small talk. And
mm.
I also love talking deep, and I'm like too much, too loud, too everything. And I'm like, yeah, I'm a lot for somebody who sometimes on the spectrum, it's like too much, tone it down, girlfriend. Like,
Yeah, I mean, like, I would rather pull out my own fingernails than engage in small talk. Like,
yeah,
that sounds
yeah.
like a more enjoyable experience to
Ooh.
me. Or, like,
Yeah.
dental work without anesthesia. I'm
Oh
like,
my
"Okay, that's
gosh.
fine." But, like, please don't make me talk about the weather. But, yeah, you're
Right.
right that actually hyposensitivity is also part of it. Like, this plays into my experience of chronic pain
Mm,
because, like, yes, I notice when I'm in pain, but often the signal doesn't really reach my brain and I don't really process it until my pain is really, really, really high. Because,
mm,
other people will be far more tuned into their pain. And they'll be like, oh, my finger kind of hurts. Whereas I will be like, I'm feeling something in my body. What am I feeling? And so that can
wow.
be difficult in managing chronic pain because, you're supposed to start managing your pain when it's at low levels. I'm
Mhm.
not necessarily getting the signal to my brain, hey, you're in pain, you need to do something about it now, until it's already at the point of like, how do we even manage this? This is through the
Mm,
roof. And so that's something. It was also really difficult in getting a diagnosis because, like, doctors kept asking me to describe the quality of my pain, and I was like, "I
mm.
don't know. It hurts." Like,
Mhm, mhm.
and I'm a writer, I just, like I really struggle with actually describing the sensations in my body because so
Yeah.
often my brain is like, "I'm having a sensation. How do we respond to that sensation?" And there's this disconnect of like, "Okay, I need to put these 2 signals together, and I can't quite do it yet. It takes me extra time." And so for me, it's taken a long time to learn to read my body because
Yeah.
I don't pick up on those signals as quickly as other people do. And also, the other thing is the stress of masking and the stress of
Yeah.
being in the neurotypical world exacerbates all of these symptoms because, anybody who lives with chronic pain or chronic illness, the first thing a doctor tells you is you need to learn to manage your stress or you need to learn to eliminate stress. Okay, how do I eliminate the stress of fluorescent lights?
Yeah.
I can't be like, guys, we need to remove all the fluorescent lights from my hometown and every single place I'm going to go because they make my head hurt. Like, that's
Yeah.
not going to happen. That's unrealistic.
Right. Yeah, we always have like a two-prong approach for sensory sensitivities. There is this idea of a threshold, right? We have different thresholds. Like I'll give it taste is always a simple one to explain. Like, my threshold for spice is very low. It takes a small amount of input to evoke a response. I'm like, oh, that feels like too much for like a little bit of pepper, right? So, but let's say I'm living in a world where there is pepper everywhere. You either have to then say, I'm going to have a workaround to avoid pepper, or I need to increase my threshold.
Mhm.
But there are these kind of points where you're like, there is no more, there's no higher. I'm going to be able to
Yeah.
go. Like, and so then I have to do the workarounds. Can I avoid it? Or can I give myself some psychological tools to cope in the face of this aversive stimulus? I mean, when you maybe there are examples, I don't know, this is such a weird one, but like when people have a baby and they might be really sensitive to smell, you have to get used to baby smells and
Yeah.
poop and farts and throw up and everything really fast when you have a baby. And maybe your threshold actually changes. You mentioned cadaver lab earlier in occupational therapy school. I was extremely freaked out when we first went into the cadaver lab, and I thought I was going to throw up, and I was like, I can't handle this. But because there was only so much I could do, I did kind of slowly get my threshold a little bit higher, in terms of my ability to cope with, the smells and the psychological experience of being with, cadavers that weren't, something that I kind of had prepared myself for. So, but long story short, that's a lot to be coping with all at the same time.
Yeah, and I
So,
mean, and there are things you can do. Like, for example, I'm learning to unmask. So, like, one thing, like the aggressive raising of my eyebrows triggers two really stubborn trigger points at the back of my neck, which then causes me to have just mind-bogglingly painful headaches and neck pain. But if I learn to unmask and I don't aggressively raise my eyebrows, which is a very difficult thing to unlearn to do when you've been doing it for like 20 years. It's like, like I will do really, really well for a while. And then I'm like, what happened to your eyebrows, girl?
mhm.
They're up by your hairline. And so it's something that I'm, unlearning. But the more I unmask, the higher my tolerance for stuff like fluorescent lights or traffic noises or stuff like that,
Mhm.
it goes up because the stress on my body is going down. And this is a really interesting thing that, like, I think a lot of people, they don't think about the fact that you can live with multiple conditions and those conditions can interact with each other and make things more
Yes.
complicated.
Yes, yes. Sorry, I didn't mean to. I'm aggressively agreeing with you now. But no, and I think changing habits is huge, especially when you've had positive reinforcement for those habits, right? And the other classic one with autism is like, oh, look me in the eye, look me in the, look so and so in the eye. And there is even like a sensory explanation for that, at least in some of the first person accounts I've read from autistic individuals saying, it's sensory overwhelm when I look someone in the eye. And I thought that was I don't know if that's what you experienced too, but I know
Yes.
not everyone does, but yeah. Okay. So you do too. And it's
Yeah.
like, there's so much communicated through eye contact, that I can totally see why that would be, overwhelming. And so maybe knowing, like, I remember when I went to, this is going to sound random, but when I went to Northern India, and worked, briefly with a nonprofit I was with some, Tibetan children, we learned that in the Tibetan culture, it's actually seen as very disrespectful to look someone in the eye, and it's more respectful to look away, so it's very arbitrary, some of these social norms. Why is it the norm in American culture to look someone in the eye? I don't know. But, can we say, hey, I don't, just because it's what I'm used to is someone looking at me in the eye. If I'm talking to Claire, I'm going to know that that's not comfortable for her. So I don't want you to look me in the eye, like that kind of thing. We all should be more open to accommodating each other, in other words.
Yeah, I mean, like, I learned how to fake eye contact at a very young age because I hate eye
Mm,
contact. Like, for me, making eye contact with people, I'm okay with brief eye contact, but
mhm,
prolonged eye contact makes me I can only describe it as, like, I feel like a rabbit being hunted. I
mm,
feel like I have to run away because it is so utterly overwhelming for me. But neurotypical people really like making eye contact, at least in America. They
yeah.
really like making eye contact, and if you don't make eye contact while having a conversation with them, they don't know how to function. So, like, I learned how to fake eye contact at a very early age, or like I just wear sunglasses when I'm talking to people outside so that they
Mm.
don't know that I'm not making eye contact with them.
Mhm, mhm. That's a benefit of being in California.
Yes.
That wouldn't work for more than a couple months in Seattle. But no, thank you. I mean, and I think the stress of living as a neurodiverse person in a neurotypical world is, I mean, cannot be understated. And to be told, and I used to work with like elementary age children, it would break my heart really seeing how, imagine every single day constantly being told that who you are and how it makes sense for you to be in the world is wrong.
Mhm.
You need to sit still, you need to look in the eye, you need to stop flapping, you need to do that, and it's like sorry, I'm just going on my soapbox, but no wonder, this stress and trauma in childhood is associated with the development of autoimmune diseases and chronic illnesses in general. There's tons and tons of work on that. And so it's no surprise that people who are, autistic or neurodiverse are at a higher risk of developing chronic illnesses because they've had to submerge who they are for so long. I don't want to speak for
Yeah.
the population, but that's just a phenomenon
Yeah,
I've
I
been
mean, and that's a
following.
really good way of putting it. And I mean, the question I get sometimes is like, okay, well, is this autistic burnout or is it myofascial pain syndrome? And
Mm.
the answer is yes. It's
Mhm.
both. There's no like I I can't know for sure, but like I know that my burnout started far before the myofascial pain syndrome started, but I do wonder maybe I would have been able to recover from the initial myofascial pain if I hadn't been burnt out. Maybe if I hadn't had this
Mm.
stress on my body, I wouldn't have the symptoms that I have now. And I have no
Mhm.
way of knowing that. But it's kind of this chicken egg scenario of like, which came first? Well, they're probably interconnected and there's really no way of separating them.
Yeah. And what are some of the ways currently that you are I just wanted to make sure I cover it. Currently for your myofascial pain, what are some of the treatments that are working? Are you still doing physical therapy?
Yeah, so I
Okay.
do physical therapy pretty much every week. I also go to acupuncture every single
Mhm.
week. And I have a lot of stuff that I do at home. Like, so my approach to healthcare, I guess, could best be described as integrative medicine. I use both pharmaceutical and more quote unquote natural techniques to treat my myofascial pain syndrome. So, like, I don't really take Celebrex every day anymore. That that worked for a while, and that was a really helpful tool to get my body out of crisis mode. And this is something that I kind of want to like highlight as something that I've used in the past because I know some people who have inflammatory arthritis are scared of Celebrex because it's like an NSAID and so it has the same risks. I would encourage you, if your doctor recommends it, just to try it. It could be a really helpful tool in your toolbox. It is the reason, why I'm no longer in crisis mode. It's the reason why I'm recovering. And, now I've moved on from using it every single day. And now I actually rely on turmeric supplements instead of Celebrex to manage day to day pain. I also take an antidepressant called Cymbalta, which also helps kind of calm down my nervous system. I do a lot of physical activity at home. I really try to prioritize gentle movement every single day. I'm a runner and I do some weight training and I do yoga. And the thing that really helps me is getting out every single day and moving, as well as keeping on top of all the supplements that I take and going to PT and doing the exercises that my PT
No,
recommends.
those are not the same thing. Yeah, going to PT and actually doing the home
Yes.
exercises. Yeah.
Not it's not the same thing.
Yeah.
And trust me, as a future physical therapist, let me just say, your PT is not giving you these exercises just to be mean to you. There's
Yeah.
actually a reason why they're giving them to you. And you can modify them and you can change them. And like if you don't have the spoons to do it every day, that's okay.
Right.
Try to do it regularly. And
Right.
like that's the thing, that really has worked for me is creating this routine where I take my medication regularly. I move regularly. I stay on top of my appointments and I do my exercises. Those are the things that help me because, myofascial pain syndrome is one of those things that when it flares up, it gets really bad really
Mm-hmm.
quickly. Like and you can feel it coming on for a few days, and I will often have this period of like, okay, I feel myself going into a flare. If I, play my cards right now, and I like, make make sure that I walk more and I stretch more and I like do some myofascial release at home, I can maybe head off this flare. But if I ignore it, I am going to end up in a horrific flare and I'm going to have to do extra PT and extra acupuncture and take, extra medication to try and manage these symptoms.
Oh, I know. It's so much easier like to prevent than it is to catch up once you're already in that flare. So yeah, learning to recognize those early warning signs and doing your strategies and tools there is huge. And before we get to the rapid fire questions, I just wanted to make sure to give you a chance. Is there any advice you would have, or just words of encouragement for somebody who is in that really, what do we call it? The long and convoluted, undiagnosed period. Is there anything else you would say to someone currently experiencing that? It's a hard one.
I think the first thing I would say is you're not crazy. You are not crazy. There is something going on with you. There's something wrong. And I know that being in this gray area is a really, really scary place to be, but you're not going to be there forever. And I would really encourage anybody who is in this muddy and messy space pre diagnosis to, first off, trust your gut because you do know what
Hmm.
is going on in your body. No, you're not a doctor. You can't give yourself a diagnosis, but you are the foremost expert on what is going on in your body. Secondly, I would encourage you to keep your mind open. Don't get so locked on one diagnosis that you don't see signs of what else it could be. And just because your doctor thinks that you have one thing doesn't mean you're necessarily going to get that diagnosis. When I first got sick, if you had told me that the diagnosis would be myofascial pain syndrome and autism, I would have been like, what are you talking about? That's
Hmm.
saying there's no way it could be that. There has to be something else going on. But the thing is, what you want at the end of the day is the right diagnosis. You don't
Yeah.
want a specific diagnosis. You want the right one for you. Maybe that's psoriatic arthritis, and the thing that you need is a biologic. And that's going to be the thing that helps you heal and helps you make progress. Maybe what you have is lupus and you need some other treatment. Maybe you're experiencing autistic or ADHD burnout and you need
Hmm.
strategies from neurodiversity affirming care that's going to help you
Hmm.
recover. But the point is, you need to stick it out and trust me, have some faith and trust that you will find the right path for you. It might be
Hmm.
completely different from what you expected, but once you find yourself on the right path, you will make progress that you can't even imagine that you'd be able to make right now. And also, it's okay to be sad and scared in this
Hmm.
space. It's totally okay. You don't have to be fine all the time. In fact, I encourage you to not be fine. It's okay
Yeah.
to be angry. I also encourage you to find a space wherein you can talk with other people who have been there. Here's my plug for Room to Thrive. Like, but even if you don't join Room to Thrive, find some space, find some community wherein you can learn new things and also have compassionate, caring people who've walked the same path to help you.
100%. It's every single time we have a meeting, it blows my mind how deeply many of us feel alone in our experiences. I've told my story of feeling medically gaslit so many times, and it's like when I get those nods in the group, if I mention it, those nods from the other people, like, yeah, that was rough. Like that, you
Mm.
shouldn't have had to experience that, and just that validation. Cause we can be so hard on ourselves. Like, I should have explained it better. I shouldn't have believed them when they said I was just stressed. Like, I should have worked harder to get myself a diagnosis earlier, just, yeah. It's like when you have this group of friends, or chronic illness buddies who can affirm you, it's beautiful. It's a
Yeah.
beautiful thing.
Yeah, I mean, my favorite part of Room to Thrive meetings, and I totally did not expect this, but, like, my favorite part is seeing when someone is sharing their story and everybody else's screen starts lighting up and the chat starts scrolling and everybody is sending heart emojis and stuff like that. That is my favorite part. That is that
Me
is the best
too.
part of just, like, there's just this quiet acknowledgement of, like, "We hear you, we see,"
Yeah.
and having that when you're living in a really difficult time is so, so valuable.
Yeah, I'm so glad you joined, because and there are people who join Room to Thrive who are in that same period of a kind of a undiagnosed, or preliminary potential diagnosis of a inflammatory arthritis. And it really is the majority of what we talk about in the group, in the support part. It's true for any chronic illness. It's not just specific to rheumatic disease, but some of the education part is specific to rheumatic diseases. But okay, I'm going to get to the some of the rapid fire
The rapid
questions.
fire questions.
Yeah, yeah. We just talked about words of wisdom for people who have not gotten a diagnosis yet. Do you have any additional words of wisdom for people who just did get a diagnosis, maybe, and are like, wait, okay, I wanted a diagnosis, but then you're like, I'm also freaking out a little bit.
Okay, I do. So I'm going to read a very, very short poem that I wrote about a year ago when I had one of my biggest breakthroughs in managing my chronic illness. This is the poem that I wrote. Chronic illness is not a war you must constantly fight, never ceasing, even for a moment. You can lay down your weapons, rest your hands gently upon your ailing body, and say, enough is enough. Today I am your friend. Tomorrow I will also be your friend, and every day hereafter. Listen closely, and you will hear your ailing body whisper in a ragged, hopeful voice, no more than a breath. Thank you.
That's amazing. Wait, I'm going to give you a heart again. I already gave it one heart. That was I am going to re-listen to this recording again, because that was beautiful. It's so easy to fall into that warrior mentality instead of
Yeah,
the friend. Do you have a favorite joint pain gadget or tool in your toolbox, or myofascial pain
I have
tool?
two.
Okay, yeah.
So the first one is the neck hammock, which
Yes.
is a device created by a PT that offers very gentle cervical traction. If you have chronic neck pain, this is the bomb. It is
Okay.
amazing. The one caveat I will say is that if you have like EDS or another
Oh yeah.
hypermobility syndrome, do not use the neck hammock. Cervical
Mhm.
traction is not good for you. But if you don't have, a hypermobility syndrome, you're good to go. And it could
Mhm.
save you quite a bit of money because you don't have to go to PT as often. Uh,
Mhm.
then my second one is an electric blanket. I'm probably the only person in Southern California who regularly uses an electric
No.
blanket, but they
Yes.
are amazing.
Awesome. I love it. And then do you have a favorite book or movie or show you've watched recently?
Yes, if you want a happy little cozy escape from the complexity of the world and the complexity of living with chronic illness, go read The House in the Cerulean Sea. It is
Oh.
just this heartwarming book about family and love and magic and home, and it is just one of the most heartwarming books I've ever read, and it is like my go-to audiobook on a bad flare day.
Oh my gosh, I am going to get that tonight. And then do you have a favorite like mantra or inspirational saying for difficult days?
So one thing that I really like to do is I like to talk to my body and acknowledge what I'm feeling. So
Mm,
often on really bad pain days, what I will say to my body is, thank you for communicating with me.
mm,
I appreciate what you are trying to tell me. I'm doing my best to listen, and I'm doing my best to help you.
I love that. I love that. It's kind of like you would speak to a toddler. You know what
Yes.
I mean? It's like, okay, I see you're having some big feelings and you're communicating those. No, I love it. And then what is something that is bringing you joy right now?
Okay, so this
Mhm.
is one thing that I love about being autistic. I notice things that other people don't, and I find joy in big things and small things. So I want to share a big thing that brings me joy and a small thing that brings me
Okay.
joy. The big thing that brings me joy is I now have a little running buddy. He's a little boy who has cerebral palsy, and we run races together. And I push his wheelchair while I run, and it is so much fun. I tell you, I have the best running partner ever. This kiddo is hilarious and smart and funny, and he loves being outside. I
I
have
love it.
never had so much fun running than these past few months than when we have started running together. It's the best.
I
He brings
love
me
it.
so much joy. Then the small thing that is bringing me joy is this absolutely dorky Sherpa blanket that I got from LL Bean. It has a
Oh,
hood and pockets, and it's amazing. It's so cozy, and it's like you're just like being wrapped in this warm, fluffy cloud, and it
oh my
makes me
gosh.
so happy every single day.
Oh, I'm also going to go look that up. That sounds amazing. And then last one, this is a little bit of like a what's the meaning of life question, but what does it mean for you to live a good life and thrive with a chronic illness or chronic condition?
So for me, living a good life with chronic illness means that I'm not fighting with my body, that
Mm,
I am not trying to battle against my body, but instead I am friends with my body and I am acknowledging all the things that my body is going through and all the things my body has gone through. Like, my body has survived so much. It has come so far. And it's really easy to be angry at your body once you get a chronic illness diagnosis. It can be so frustrating. It can be really sad. But at the end of the day, you kind of have to step back and be amazed at how much your body has been able to survive. And so for me, living a good life with chronic illness doesn't necessarily mean that I don't have any flares or I don't have bad days, but then I'm able to step back and acknowledge that my body has survived a lot and it deserves not my anger or my irritation, but my friendship and my love.
my gosh, I love that. I love that. Thank you so much. And where can people find you online? I will put your social media handle in the show notes, but
So I have an Instagram page called Chronic Quirkiness where I write about what it's like to live life with a chronic illness and what it's like to recover from autistic burnout. And I also post a lot of pictures of my dog.
that
um,
is very key to
yeah,
life.
so if you would like to hear about what my life is like living with myofascial pain syndrome and autism and a very elderly pug mix, you can come and hang out with me.
I love it. Thank you so, so much. Is there anything else you want to say before we say goodbye?
I don't think so. Thank
Okay.
you so much for having me, Cheryl.
Oh my gosh. No, it has been such a pleasure. And again, I really appreciate just your openness
Mhm.
about talking about all of everything we've discussed. It's a lot to process. And I know that there are so many people listening right now who are feeling more hopeful and less alone. And like there maybe is a light at the end of the tunnel for them. So thank you so much.
Yeah, it was so good to talk with you.
Yay. Bye bye for now.
Bye.